Hypertension Awareness Series Episode 4, Primary versus Secondary Hypertension. Good morning and welcome to today's post. If you have hypertension, the most important question is not just how high it is, but why you have hypertension. What is causing the hypertension? We have two main types of hypertension, primary or secondary hypertension. Let us start with the most common. Number one, primary hypertension. It's also called essential hypertension. 90% or 9 out of 10 have primary hypertension or essential hypertension. This has no underlying cause. It develops slowly over many years and has no specific cause. It is due to things like family history, getting older and stiff blood vessels, excess salt, excess weight, not exercising enough, and also alcohol. If you have primary hypertension, there is no single underlying cause which can be treated. This is why most people with hypertension need long-term lifestyle changes and medications to keep their BP controlled. What about the second type? This is called secondary hypertension. It occurs in 5 to 10% of the people, and it means the blood pressure is high because there is an underlying cause or a medical condition or something that you are taking. And here is the key message. If we treat the cause, the blood pressure can improve and even return to normal. What are some of the causes of secondary hypertension? They include problems with the kidney failure, narrow blood vessels in the kidney, hormone problems, endocrine disorders like thyroid disorders, sleep disorders like sleep apnea, which may make the pressure go up. Pregnancy is also a cause of secondary hypertension. We have conditions like preeclampsia and eclampsia, which are very dangerous. And after delivery, the blood pressure should go to normal latest by 6 months. So pregnancy is a secondary cause. Other causes are medicines and substances that can also raise blood pressure, and many people do not realize this. Some pain medications like non-steroidal anti-inflammatory agents, steroids, the prednisone, family planning pills, the combined pills, some antidepressants, herbal medications, all these can raise the blood pressure. So always tell your doctor what you are taking, even herbs and supplements, because sometimes changing those can normalize your blood pressure. When do we suspect secondary hypertension? Doctors become suspicious when you have high blood pressure in extremes of age, very young ages below 30 years. Blood pressure suddenly becomes very high. Blood pressure is not controlled even with several medications. Your potassium in the blood is low, or blood pressure which was previously controlled suddenly worsened after being stable. In these cases, we delve deeper to look for an underlying cause. So what should you do today? Ask your doctor, is my pressure primary or secondary? Do I need further tests to check for secondary causes? Tell your doctor about all other medications or even herbs that you take, and never ignore sudden changes in your blood pressure. So a quick summary of today's lesson. We have two types of hypertension, primary or essential hypertension, which is the majority, 90% of the people. There is no underlying cause and needs long-term treatment. Then secondary hypertension, where there is an underlying treatable cause, occurs in 5 to 10% of the patients. Finding the cause can change the whole treatment plan. So remember, high blood pressure does not always mean lifelong disease without answers. Sometimes there is a treatable cause. And even in primary hypertension, with the right treatment, people live long and fully active life. If you are a healthcare provider, always assess your patient for primary, if they are primary or secondary hypertension, because secondary hypertension has an underlying treatable cause. So stay tuned for our next episode, where we explain about the hypertension stages. Not all high blood pressure is the same. I will show you why some numbers are more dangerous than others and how doctors decide on the urgency of treatment. Dr. Muthui-Mutua, saving lives one heart at a time.